Have you ever wondered about the silent yet potentially devastating condition known as chronic kidney disease? Chronic kidney disease, or CKD, is a global health concern affecting millions of individuals, yet it often goes unnoticed until it reaches advanced stages. CKD is a condition characterized by the gradual loss of kidney function over time. Our kidneys play a vital role in our overall health, filtering our blood, removing waste through urine, regulating our body's fluid levels, and keeping our electrolytes in check. However, when someone has CKD, these functions start to decline, leading to a buildup of toxins and waste in the body. CKD is often termed a silent killer because it can progress quietly over years without presenting noticeable symptoms. It's a silent invader, slowly damaging the kidneys and affecting their ability to perform their essential functions. The prevalence of CKD is increasing worldwide, making it a critical public health issue. It's not just a concern for the elderly. CKD can affect individuals of all ages, from all walks of life. What's more, it's a significant risk factor for other serious health conditions, such as cardiovascular disease. Knowing about CKD is the first step in combating this silent disease. Awareness can lead to early detection, and early detection can lead to better management and potentially slower progression of the disease. Understanding this disease is not just for those who have been diagnosed, but for everyone. With the rise in conditions like diabetes and high blood pressure, which are key risk factors for CKD, it's becoming more and more important to be informed about kidney health. To detect CKD early, it's important to understand its signs and symptoms. But remember, knowledge is only the first step. Applying what we know and making necessary lifestyle changes can make a significant difference in managing CKD and maintaining our overall health. One of the challenges with chronic kidney disease is that it often goes unnoticed in the early stages. This silent progression is what makes CKD a particularly insidious condition. But before we delve into the signs and symptoms, let's remember that our kidneys are powerhouse organs, filtering waste products from the blood while regulating fluid balance, electrolytes, and blood pressure. Now, when it comes to CKD, the signs and symptoms are often subtle and may not appear until the disease has progressed significantly. In the early stages, you might not notice anything at all. It's a stealthy foe, creeping up without warning. As the disease advances, though, symptoms can become more pronounced. You might feel unusually tired or have less energy than usual. This happens because your body has trouble cleaning your blood, leading to the buildup of toxins that can cause fatigue. Swelling in the ankles, feet, or hands can also occur, due to the kidneys' diminished ability to keep a balance of fluids in the body. You might also notice changes in how much you urinate as your kidneys struggle to filter your blood. Nausea, another symptom, can be a sign that waste products are building up in your body. High blood pressure can also be a symptom or a cause of kidney disease, creating a vicious cycle that further harms the kidneys. There's also a less tangible sign, the feeling that something's just not right. You know your body best. If you feel off, it's worth speaking to a healthcare professional. Recognizing these symptoms can lead to earlier diagnosis and treatment. But remember, CKD is a master of disguise. Regular checkups are key to catching this condition early, so make sure to keep those appointments with your healthcare provider. And that's the rundown on the signs and symptoms of chronic kidney disease. Up next, we'll dive into the dietary changes you can make to manage CKD. Stay tuned, you won't want to miss this. The good news is, there are several strategies to manage CKD and maintain kidney health. One of the most effective is something we all do every day: eat. Yes, that's right. The foods we consume play a critical role in managing and even preventing chronic kidney disease. Now, you may be wondering, what should I eat for optimum kidney health? Well, it's all about balance and making smart choices. For starters, you'll want to focus on foods that are low in sodium, potassium, and phosphorus. These elements, though necessary in small amounts, can build up in your system when your kidneys aren't functioning optimally, leading to further complications. So, where do you find these low sodium, low potassium, low phosphorus foods? Look no further than fruits and vegetables. These natural goodies are packed with vitamins, minerals, and fiber, all of which aid in maintaining kidney health. Apples, berries, bell peppers, cabbage, and onions are all excellent choices. But don't stop there. Make sure you're getting enough lean proteins as well. Foods like fish, skinless chicken, and eggs provide the protein your body needs without overloading your system with unnecessary fats. And let's not forget about whole grains. Foods like brown rice, whole wheat bread, and oats are rich in fiber and can help control blood sugar levels, which is particularly important if you're also managing diabetes alongside CKD. Now, this may seem like a lot to take in, and it's true, dietary changes can be challenging. But remember, you're not alone. A dietitian or nutritionist can help you navigate these changes and develop a meal plan that suits your individual needs. So to wrap up, remember this: what you eat significantly affects your kidney health. By incorporating a balance of fruits, vegetables, lean proteins, and whole grains into your diet, and limiting your intake of sodium, potassium, and phosphorus, you can take a major step toward managing CKD and maintaining overall health. In addition to diet, other lifestyle factors play a crucial role in managing CKD. One of these key components is hydration. Just as plants need water to thrive, our kidneys also need to stay well hydrated to function optimally. Water plays a critical part in helping our kidneys filter out waste from our bloodstream. It's like a river that sweeps away unwanted debris from our bodies. So, drinking ample water throughout the day is a simple yet effective way to support kidney health. Now, let's talk about the quantity. While the conventional wisdom of 8 glasses a day is a good starting point, the exact amount can vary depending on factors like your body size, activity level, and climate. But remember, overhydration can also put a strain on your kidneys, so balance is the key. Listen to your body's cues and keep your water intake consistent. But hydration isn't the only lifestyle factor that impacts kidney health. Let's shift gears and talk about stress management. In our fast-paced world, stress seems to be an inevitable part of life. But did you know that chronic stress can impact your kidney function? That's right. High stress levels can raise your blood pressure and, over time, put added pressure on your kidneys. So how can we combat stress for the sake of our kidneys? Well, the answer lies in practicing stress-reducing activities regularly. This could be anything that helps you relax and unwind. For some, it might be yoga or meditation, which have been shown to lower stress levels and improve overall well-being. For others, it could be deep breathing exercises, which can help bring down your heart rate and induce a sense of calm. But remember, what works for one person may not work for another. The key is to find what works for you and make it a part of your routine. Because at the end of the day, managing stress is not just about feeling better, it's about preserving your kidney health. Managing stress and staying hydrated are vital steps towards maintaining kidney health. So, keep that water bottle handy and take a few moments each day to unwind. Your kidneys will thank you. Effective management of CKD often involves a multifaceted approach. One crucial aspect of this is the management of any underlying health conditions, such as diabetes or high blood pressure. These conditions can exacerbate the progression of CKD, making their effective management a key part of any KKD strategy. It's essential to work closely with your healthcare provider to devise a tailored plan that fits your personal health profile. This may involve medication to control blood sugar levels or blood pressure, lifestyle modifications, or a combination of both. Remember, every individual is unique, and what works for one person may not necessarily work for another. This is why the role of a healthcare provider is so important. They can provide personalized advice, monitor your progress, and adjust your management strategy as needed. Remember, effective management of underlying health conditions can help slow the progression of CKD. As we wrap up our discussion on chronic kidney disease, let's recap the main points. Chronic kidney disease is a condition that slowly impairs kidney function, leading to a buildup of toxins in the body. The early stages might not present noticeable symptoms, but as the disease advances, signs such as fatigue, swelling in the ankles, changes in urine output, nausea, and high blood pressure may become apparent. To manage CKD, maintain a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, but low in sodium, potassium, and phosphorus. Hydration is key, and stress management through activities like yoga and meditation can also play a beneficial role. If you have health conditions like diabetes or high blood pressure, work with your healthcare provider to manage them effectively, as this can slow the progression of CKD. Remember, early detection and proactive management are key to maintaining kidney health. Don't forget to like, share, and subscribe for more valuable health tips. Stay healthy!